as to where we are. The number of cases increase, which is nothing new. It's happened every day since we've started this. It's been a long month. Something a little bit different than the data today. We're not really 100% sure yet what the significance is as we're feeling our way through this. Number of people tested, 18,000. Positive cases are up 8,000, total of 122,000 cases. Number of patients discharged, total discharged up is 12,000, 1,700 discharged in one day. Number of deaths is up. That's the bad news. It's 44,159. And we pray for each and every one of them and their families. And that is up, and that is the worst news. But the number of deaths over the past few days has been dropping for the first time. What is the significance of that? It's too early to tell. This is the impact by state. But as I said, the interesting blip maybe in the data, or hopeful beginning of a shift in the data and the number of cases. Total number of new hospitalizations is 574, which is obviously much lower than previous numbers. That's partially a function of more people being discharged. But you see ICU admissions are also down. The daily intubations down slightly from where it was. Again, you can't do this day to day. You have to look at 3 or 4 days to see a pattern. Discharge rate is way up, and that's great news. And the statewide balance of cases has been relatively stable for the past few days. There is a shift to Long Island. Upstate New York is basically flat, and as Long Island grows, the percentage of cases in New York City has reduced. This is when, for those people who look at the data, you have all these projection models, and what's been infuriating to me is the models are so different that it's very hard to plan when these models shift all the time. But there's also a difference of opinion on what happens at the apex, right? All the models say you go up until you go down. Thank you very much. Then there's a difference of, is the apex a point or is the apex a plateau? In other words, do you go up, hit the high, and then immediately drop, or do you go up and then there's a plateau where the number of cases stays high for a period of time and then drops? There's a difference of opinion. So you have to think of that when you think about what you're seeing in the numbers, because you could argue that you're seeing a slight plateauing in the data, which obviously would be good news because it means you plateau for a period of time and then you start to come down. And we're all feeling our way through this, and we have the best minds in the country, literally on the globe, advising us, because New York is the first. I also think it'll be very helpful for the other states that follow. I was just talking to Dr. Zucker about codifying everything we're learning, because when the next states start to go through this, we hope that they can benefit from what we're going through. But we're looking at this seriously now, because by the data, we could be either very near the apex, or the apex could be a plateau, and we could be on that plateau right now. We won't know until you see the next few days. Does it go up? Does it go down? But that's what the statisticians will tell you today.